Colon cancer is the second deadliest tumour in both men and women. Colon cancer has been constantly increasing for the last 20 years, even though it is preventable. As a matter of fact, colon cancer has a slow progression, an average of 10 years, and usually originates from a benign lesion called a polyp. Consequently, an early detection and identification of a polyp allows a drastic reduction of new cancer cases. Next to the more invasive exam techniques, such as conventional colonoscopy and double barium enema, there is virtual colonoscopy, a minimally invasive, safe, well-accepted and effective exam method, which has recently been endorsed by the main international scientific societies and associations and by the Italian Ministry of Health. Virtual colonoscopy offers a complete visualization of the colon's lumen without having to introduce an endoscope of any kind. All you need is a last-generation CT scanner and a dedicated software. Prior to the exam, the patient has to simply follow a 3-day low-fiber diet, mainly avoiding fruit and vegetables. It is not necessary to take a laxative, except for a mild over-the-counter motility stimulator. Immediately before the exam, it is necessary to distend the colon with air by inserting a thin, flexible Foley catheter. Alternatively, you can obtain distension by using an automatic pump that insufflates carbon dioxide, with the advantage that the air is reabsorbed far more quickly. No sedation is required for this kind of exam, nor does it require any other administration of drugs. After the colon distension, 2 low-dose prone and supine position CT scans are required on the patient in a total of roughly 15 seconds. Notwithstanding the double acquisition, the low radiation dosage acquisition technique reduces to the minimum any possible risk of biological damage on the patient, albeit considering that the dosage is only just superior to the annual exposure of an individual to sunlight, and inferior to the exposure of certain working categories, airline pilots and mine workers, for whom no demonstrated increase in tumour pathologies has been correlated to the radiation itself. At the end of the exam, the patient can immediately walk away to carry on with the daily routine activities. Virtual colonoscopy is recommended as a complete substitution of double barium enema in cases of incomplete conventional colonoscopy, in patients who are either elderly or with frail health conditions. Today, as a possible alternative preventive exam for colon rectal cancer in asymptomatic subjects without familiarity, and in those subjects who have no intention of undergoing a conventional colonoscopy.